welcome to this short topic. My name is Dr. Achievements, and I'm taking the topic of pharmacodynamics. Pharmacodynamics is the study of drugs, effects, and it starts with describing what the drugs do and goes to explain how they do it. Alright, coming to principles of drug action, there is the basic types of drug action can be broadly classified into stimulation, depression, irritation, replacement, and cytotoxic action. In the next slide, I will explain stimulation. Stimulation is a selective enhancement of the level of activity of specialized cells. Adrenaline stimulates the heart, and caffeine stimulates the salivary gland. It's about stimulating enhancement of the level of activity of specialized cells. Coming to depression, selective diminution of or discontinuation of activity of specialized cells, barbiturates depress CNS, quinidine depress heart, omeprazole depress gastric acid secretion. Right. This topic is pharmacodynamics. Okay, and in this we are explaining the principles of drugs action. Alright. Now coming to irritation. Irritation is non-selective, often noxious effect is particularly applied to less or destroy specialized cells, epithelia, connective tissue. Strong irritation results in inflammation, corrosion, necrosis, and morphological damage. Strong irritation results in inflammation, corrosion, necrosis, and morphological damage. Replacement use of natural metabolites, hormones, or their congeners in deficiency states. Levodopa in Parkinson's disease, insulin in diabetes, mellitus, iron in anemia. Like you're using these things during insufficiency. We're using this to replace the insufficiency in the body. That is replacement. Like the cytotoxic actions, selective cytotoxic actions on invading parasites. Pardon the noise coming from outside. Something is going on there. And okay, let's continue. Cytotoxic action, selective cytotoxic action on invading parasites or cancer cells, attenuating them without significantly affecting the host cells. Utilized for cure or palliation of infection, e.g., penicillin, chloroquine, and cyclophosphamide. These medications helps in cytotoxic actions. Uh, we say cytotoxic action on it adds on invading parasite or cancer cells, attenuating them without significantly affecting the host cells, like killing infections or something like that. Okay, mechanism of drugs action. Majority of drugs produce their effects by interacting with a target biomolecule, which usually is a protein. Majority of drugs produce their effects by interacting with biomolecule, which usually is a protein. Such mechanism confers selective of action to the drug. Functional proteins that are the targets of drugs action can be grouped into four main categories. You have enzymes, ion chains, and transport and receptors. So in enzymes, almost all biological reactions are carried out under catalytic influence of enzymes. Drug can either increase or decrease the rate of enzymatic mediated reaction. In this case, it's saying almost all biological reaction is carried out with the influence of enzymes, especially under catalytic influence of enzymes. Catalytic means breaking down. Alright, drug can either increase or decrease the rate of enzymatic mediated reaction. Alright, drug can increase the effect of enzymes in the body, alright, or decrease the effect of enzymes in the body. Going to enzyme inhibition, selective inhibition of a particular enzyme is a common mode of drug action. Such inhibition is either competitive or non-competitive. Alright, so you can see some types of enzymes here. You can see the endogenous substrate. You can see the competitive inhibitors. Alright, I'm not going deep into that. Ion chains, ligand gated chains, nicotine and receptors, G protein and G proteins and termed G proteins regulated chains. Cardiac P1 adrenergic receptors activated CA2 plus channel in this way. You can see CA2 plus channel picture which I've shown in this slide. How ion chain is a kind of mechanism where drug action drug performance action. Okay, some types of drugs which are there: cardiac B1 beta 1 adrenergic receptors activated by CA2 plus channel. Alright, ion chains drugs can also act on voltage operated and stretch sensitivity channel by directly binding to the channel and affecting ion movement through it, e.g. local anesthetic which obstruct voltage sensitivity Na plus channel. Right. In the transport aspects, several substrates are translocated across membrane by binding to specific receptors carriers, which either facilitate their fusion in the direct action of the concentration gradient or pump the metabolites ion against the concentration gradient. Many drugs produced through many drugs produce their action by directly interacting with the solute carrier class of transporter proteins to inhibit the ongoing physiological transport of the metabolites ion. Now coming down to receptor, macromolecule or binding site located on the surface or inside the effector cell serve to recognize the signal molecule or drug and initiate the response to it, but itself has no other function. The micromolecule or binding sites is always located in cells, and the effector cells that serve need to recognize the signal or signal the molecule, bind to it in order to perform its function. Drugs receptors can be classified into agonists, antagonists, and partial agonists. An agonist is an agent which activates the receptors, produce an effect similar to that of physiological molecule, whereas an antagonist prevents the action of the agonist on the receptors or the subsequent response, but does not have any effect on its own. Antagonist is acting to prevent, whereas agonist is initiating the effect. Where partial agonist, an agonist a partial agonist is an agent which activates the receptors to produce submaximal, which produce minimal effect to the effect, but antagonize the action of a full agonist. It's trying to produce the effect of agonist, but it's producing lesser effects instead of the full effect. But antagonize and is stopping the agonist if there's any agonist here which is producing the full effect from producing its effect. Drug potency and efficacy. Drug potency, which it refers to the amount of drug needed to produce a certain effect or response, whereas drug potency refers to the maximum response that can be elicited by. Efficacy refers to the maximum response that can be elicited by the drug. Alright guys, this is the short topic regarding pharmacodynamics, and we just went through the introduction of pharmacodynamics where I explained what pharmacodynamics means and we went to the principles of drugs action, and still under the principles of drugs action, we went and we talked about how drug mechanism function, and we have four ways whereby drug function their mechanism, using the enzymes, using the ion channel gate channels, using the transporter and receptors. And that is all for today, guys. I just wanted to share this quick